Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Good morning and welcome to the first ever Chiropractic Legal and Injury Conference. We are here today with Dr. Alicia Vartevan, and I'm Larry Lazzara, your host. Dr. Vartevan, please tell us a little bit about yourself.
Sure. Thank you for having me. I am a neuroradiologist, which means I'm a type of physician that specializes in imaging of the brain and spine. So after medical school, I did a 5-year radiology residency, and then I did an additional year just to specialize in brain and spine. So, for example, if a patient goes to their doctor with a headache or if they have multiple sclerosis or traumatic brain injury, that doctor orders an MRI. I'm the doctor that reads it, generates a report, and it gets sent back to the neurologist.
Excellent. Do you have a lot of experience in the personal injury world?
I do. A lot of the patients that we see have been in some sort of trauma. So whether that's a personal injury trauma or if it's an athlete that's had some traumatic brain injury, but a lot of traumatic injury.
So when we're working up a case, for example, and you mentioned earlier that chiropractors will refer you MRIs or brain scans, can you tell us a little bit about what it is you're looking for?
Sure. So most patients that are in our personal practice have mild traumatic brain injury, which is similar to concussion, what a lot of people would think of. So if they are seeing their practitioner, they go in, they had some sort of trauma, whether it be personal injury, so a motor vehicle accident, they fell, whatever it is, they may present with headache, they may present with dizziness, with visual changes. If those persist for a while, we usually recommend to get imaging. On imaging, we're usually looking for any evidence of small bleeds. So that's probably the most important thing that we look for. And there's certain sequences on the MRI that show that best. Other than that, you can look for little areas of the brain changing signal. So the appearance of the brain is not what you expect for someone who hasn't experienced trauma. Those would be the most common things that we're looking for.
So when somebody's in an auto accident and they go to their physician for a workup, when do you recommend that they be referred out for imaging studies?
You know, that's a tricky question, Larry, because I am a radiologist. So, there's a saying, if you are a hammer, everything's a nail. So I think everybody should get imaging. But when we're talking about actual trauma, for the cervical spine, which is your neck, the mid-back or low back, I would say get it early. The sooner the better, because then you're going to see signs of that acute injury that you may have experienced. Same thing with shoulders or knees. The brain, I'm a little bit different. Most of the time with the brain, if you do conservative therapy, hydration, nutrition, lifestyle changes, you can usually have your brain function return to normal. There's a percentage of patients that will persist to have abnormal symptoms of, like I said, headache or dizziness. And then we would say, go ahead and get the imaging. But we usually will wait about 4 weeks for those. But everybody else, the sooner the better, especially if they have something called radiculopathy, which means you have pain that may be coming from your neck or your low back, but it's going down. So people will say, gosh, I just have this tightness going down my arm, or like I have this tingling in my thumb. If that's new, we say to get an MRI specifically very early.
Okay. So you mentioned the word acute
Sure.
findings. So can you tell us a little bit about what those are and what it is you're looking for when you're reviewing spine MRIs, for example?
Sure. So acute just means it has happened suddenly. So the time frame is very short. So we'll use an example of someone who's had a traumatic event. So if they had a trauma and then all of a sudden they have new pain, that would be considered acute pain, as opposed to someone who maybe has had pain for a very long time, like 10, 15 years. That would be considered more chronic pain. So that's kind of the definition between the two. When we're looking for objective findings on MRI for acute, we're looking for edema or fluid. So that's another kind of, you can use those synonymously. And those will have very specific signal characteristics on the MRI. There's certain sequences that we use that will show fluid better, that will show fat better. So if we're looking for something that's new or acute, we're looking for fluid, because that's usually the inflammation part of it. So almost like if you hit your arm and you have swelling, that's that fluid that you would see on an MRI.
When a chiropractor is thinking about which imaging company to refer the MRI studies to, what is something that is unique that your practice, Camelback Radiology, has to offer that would encourage or motivate a chiropractic office to use your specific radiology company?
Specifically, we're the only radiologist-owned imaging company in Arizona. So that is a huge advantage for patients to come through us, because we put all of the protocols together. We only use the best equipment. So the patients are just going to have the best experience when it comes to things that they don't even see. Obviously, our staff is amazing. So we have a bilingual Spanish-speaking staff who is there for them the entire step of the way. They'll tell them, what to prepare for. A lot of my staff has actually had imaging done. They've actually had their own history of trauma, so they can really put themselves in the patient's shoes. So the patient experience is amazing. And then on the back end, you're going to get only board-certified, fellowship-trained radiologists. Most of us are double board-certified because we're neuroradiologists. And so you're going to get a very high-quality read. It's myself and 8 other radiologists, so you're just going to get a better quality read, which is really helpful for the practitioner because the more detail we're able to give, the better the practitioner can actually treat the patient. So they'll know, okay, is this pain coming from this level? Is it coming from a disc herniation, for example? Is it coming from just muscle and we can treat them conservatively? Is it coming from the facets, which is a joint in the back of your neck? So we really try to give as much objective information in our reports so the patient gets the best treatment possible.
That's great. I know as a personal injury attorney, we have to prove the legal standard is a preponderance of the evidence, or in plain language, it's more likely than not that an injury resulted from a motor vehicle accident. And obviously we've had a ton of experience working together trying to identify what those acute injuries are. What are the injuries that were caused by the motor vehicle accident? But not everybody refers to your office right out of the gate. They'll send it to other imaging companies, and they might not be happy with the read. And what I mean by that is not enough details. They don't differentiate between acute and degenerative findings. And we've actually referred to you for second opinions or trauma reads. So can you tell us a little bit about those services that you offer?
Yeah, absolutely. So in addition to treating a patient from the very beginning all the way through, if they did go to another imaging center, we can actually get that disc and upload all of those images into our system and give our opinion. So even if they have maybe an original radiology report, just like you would do if you had a diagnosis of a malignancy or a cancer, you want a second opinion, we do the exact same thing. So we're able to go in and give our own opinion on what the images shows. And we do something different where we put pictures in our reports, which is really helpful for patients too, because it validates their pain, so it kind of helps them on their journey to healing as well.
Yeah, absolutely. And we use that as demonstrative evidence in a courtroom, and it really leaves an impression when you're able to show what a disc herniation looks like.
Absolutely.
And I know you circle the injury, you have an arrow pointing right through, you make it as easy as possible to follow. That's wonderful. Have you ever had a situation where somebody ordered an MRI, say, of the brain or the spine, and you found something else that they didn't know was there and made an impact on the patient's life?
For sure. We call those incidental findings. So when you have imaging done for a certain reason, but you find something completely non-related, sometimes it's not that big of a deal, but other times it could be something like a brain tumor. We see those often. Sometimes you don't have to treat those. They're small, but a lot of times patients have no idea that they have them. Sometimes they'll have something called, like, for example, a KRA1 malformation, which means that the brain position is a little bit different than you would expect for someone without symptoms. And it may be a patient that's had headaches their entire life, and then all of a sudden they're like, oh, I have a reason for my headaches. I just thought that I had a history of migraines. But probably the most memorable has been tumors that are of certain size that need surgery, and patients had no idea that they had it.
That's amazing. And are there any cases, or is there a case that stands out to you?
For sure. Actually, I had a case a few years ago. Like we said earlier, most of my patients are mild traumatic brain injury patients. So that means that they can walk and they can talk and they're okay. Moderate to severe, they're usually in the hospital because they cannot walk and talk. And so most of the findings that we have are relatively subtle. One of the neurologists that I work with closely, his name's Dr. Louis Shaya. He's here in Arizona and he's phenomenal. He sent a stat, meaning like it was very urgent MRI to get done, and which he doesn't typically do. And so I pulled up the MRI, and I was kind of expecting to see just the normal, everyday things that I see. And the patient had something called a subdural hematoma, which in itself is not necessarily like this profound finding. If you have an accident and you go to the emergency department, it's very likely that you have some type of bleed or hemorrhage in your brain. But these are not usually the patients that are coming in. So it was actually, believe it or not, I think it was a case that you had. So you were the attorney on that case. And so I pulled it up, and I was like, oh, my goodness. And so I called Dr. Shai. I was like, hey, did you know that this person had a subdural hematoma? And he's like, no, but he had this headache, and he had some red flags. I think he had a new onset of focal deficit. I'm like, yeah, so we need to do follow-up imaging. So A hematoma is almost just like a collection of blood, so almost like a bruise that you would have. And it's okay if it stays the same or gets smaller, and that's usually what happens. But you want to make sure it's not actively bleeding or seeping blood into that space. And so I told Dr. Shaya, I was like, hey, let's get a CAT scan or a CT to follow up. We did the CT about a week later, and it had gotten bigger. And then some of the CT characteristics showed that there was new or acute blood on there.
Right.
And so then we looped in our neurosurgical colleague, and we're like, hey, we have a patient that you need to see urgently. And so once he got to the neurosurgeon, they'll decompress that, so they take the blood out. And mainly because your skull is a fixed space. So if you add blood where it's not supposed to be, it'll start pushing the brain, and that's exactly what was happening. So his brain was getting pushed. So you needed to remove kind of that mass effect. But it was one of those memorable cases in the sense that I wasn't expecting it. Like it's we saw them all the time when I read for level 1 trauma centers, but it's not something that you usually have a patient walk in who's like, yeah, I've got this headache, and there's like a joke with like farmers, for example, like they're very tough people, and I think this person was probably just a very tough person who's like, oh, it's just a headache, I'll be fine. And luckily Dr. Shaya recognized it, and luckily you were the attorney on the case, so we knew that we could just expedite the medical care.
Thank you. So. I remember that case very well. And this is what I love about working with you, Dr. Shaya, and some of the other specialists, is I was able to pick up the phone. I called Dr. Shaya and I said, hey, we got a situation here. I think we have a legit serious brain injury. Can you get him in right away? And obviously he took the call. Larry, whatever I can do to help, let's do it. He ordered the stat MRI. So together we saved this guy's
100%.
life, and we were able to do a really good job wrapping up his insurance claim. So it's I love watching the teamwork, and that's actually what we're here to do today. We're going to have you're on the first multidisciplinary panel that's ever been done in the state at a continuing education conference like this. So tell us what you're most excited about for being on this panel.
I'm a chatty Cathy, so I'm excited about improvising a lot. I think I told you when we were putting this together, I don't know if I've ever given a talk or a lecture where I didn't put all the slides together myself. So I think the format that you created for this is going to be incredible. I think it's really going to be impactful for the chiropractors that are watching and listening. And like you said, it really shows the collaboration amongst the different fields. So we've got chiropractic care, we've got neurology, we have a neurosurgeon, we have pain management, of course imaging. We have imaging is the most important part of the puzzle there. But it really puts it in play, because in reality, when you see a patient, it's not like, you send it to an MRI and that's it. You're going to send it with the chiropractor, you're going to have the MRI, you're going to have the pain management potentially, you're going to have a neurologist potentially. If the patient has to see a neurosurgeon like Dr. Abdul Hamid, who's going to be on today, it just shows how actually it's done in real life. Because a lot of the lectures, as educational as they are, they're not as easily implemented in what you actually do day to day.
That's true. That's absolutely true. Well, thank you so much for being a part of the panel, and for all the work that you do. Your contributions, not only on my cases, but in the personal injury world as a whole, you do an amazing job. Thank you so much for being a part of this, and we look forward to seeing how the panel goes today.
Yeah, it's going to be exciting. I hope it's one of many that you do.
Thank you so much. All right. Thank you.
Thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.